Hi, this is Damon L. Jacobs. I'm here with Dr. Robert Grant, and we are here at the CDC Prevention Conference in Atlanta, Georgia on December 7th, 2015. How exciting is this? How amazing is this?
Well, it's always exciting to be around you, Damon.
Oh my goodness, likewise, Rob. You know, there's so much good news that's been coming out about PrEP. So much people are talking about PrEP at this conference. What right now is the estimated number in the U.S. of consumers that are currently on PrEP? I know we don't have any exact numbers, but I'm just trying to get clear exactly how many people we think are on PrEP.
Well, we know that demand for PrEP is increasing in the United States. It hit a tipping point sometime in 2013 after you started PrEP Facts on Facebook. Started providing real information to PrEP users about how well it works and the safety issues and how to use it. I mean, it was really key. And I think that since the late 2013, we've really seen a dramatic increase in demand. The FDA mandated surveillance is showing a 300% increase in PrEP use. And currently, at the end of 2014, 10 to 15% of gay and bisexual men in San Francisco were using PrEP. And the New York estimate, I think, is around 7%. So it's really starting to be used in a substantial level. We haven't seen data from 2015, but word I'm hearing is that the demand continues to increase.
Wow. Wow. So it's finally getting out there.
It's
getting out there. Now, with all these people that are using PrEP now, to the best of your knowledge, have there ever been, well, in any research trials or in any demonstration projects where adherence is measured through dry blood spotting, have you heard of any seroconversions?
No, we have not seen anyone become HIV infected who have drug levels indicating use of 4 or more tablets per week if they're a gay or bisexual man. Among women, we haven't seen seroconversions in women who are using or have drug levels indicating use of 6 or 7 tablets per week.
That's so amazing. That's so amazing.
And many of these demonstration projects are reporting no seroconversions.
Right.
And that's really exciting to see.
That is so exciting to see.
We're seeing transmission end in front of our eyes, really. It's exciting.
It's beautiful, but now here's the pink elephant in the room, and it's not such a... The also big thing that we're talking about here and the CDC is talking about are the rising rates of other STIs. The CDC just put out a press release saying that chlamydia, syphilis, gonorrhea rates are going up very quickly in the US. A lot of critics of PrEP are blaming this on Truvada. What do you think?
Well, you know, first of all, I'm happy that people are talking about sexual health and sexually transmitted infections. I think it is a topic that deserves a lot of attention. And in fact, rates of sexually transmitted infections were rising since the mid-1990s. And they really started to rise dramatically with the advent of highly active antiretroviral therapy. And then as particularly gay and bisexual men learned about strategic positioning and serosorting practices, STI rates continued to rise because people were adapting their sexual practices according to HIV status, but not syphilis status or gonorrhea status. So, you know, I think treatment of HIV was the first step that sort of increased STI rates, and then serosorting. PrEP really came on the scene very recently.
Right.
And so it really would be very hard to attribute any current changes in STIs to PrEP when so much of what we see in sexual health really started occurring in the mid-1990s.
That's what I was thinking. I mean, the CDC is saying hundreds of thousands of new infections, and there's less than, or in 2014, there were less than 20,000 people on PrEP. So I know we're a busy group, and I know we're pretty active, but we're not that active. We don't have that much power.
Well, and the other point is that PrEP provides an opportunity for testing and treatment of STIs, and it encourages people to engage their partners who come in and get tested and treated. So really, PrEP creates an opportunity to help control the epidemic.
And what would you, so then what would you say we need to be focusing on to curb these tides of STIs?
Well, I think, first of all, we need to provide real and current information to people about STIs and not link it to PrEP or treatment, or you know, just emphasize that this is part of your sexual health. It's part of your well-being as a person to think about syphilis and gonorrhea, get yourself tested on a regular basis, and ask your partners about their status as well. I think more and more as people are taking PrEP and are getting used to the idea that they will stay safe from HIV because they're on PrEP, or because their partner's on treatment, as people move toward that sense of safety from HIV, they become more concerned about syphilis and gonorrhea. Because after all, once you've solved one problem, the HIV problem, which was the bigger pink elephant, the big red elephant in the room, that makes more space for people to start thinking about other aspects of sexual health, which includes syphilis, gonorrhea prevention, as well as reproductive goals and ways to optimize all of that.
Right. You know, the other thing that's come out recently is the CDC saying that 1 in 3 doctors still don't know anything about PrEP. What would you like to say to those doctors about learning, or what do you think prescribers need to understand about PrEP right now?
Well, I think that PrEP, like all aspects of prevention care, is a job for everyone. It's a job for primary care providers, for emergency rooms, for testing centers, for sexual health centers, for reproductive care centers. It's really a job for everyone, like all aspects of prevention care. But another key thing is it's easy to provide PrEP. We have protocols and algorithms, so it really makes it easy to know exactly what tests to order and how to prescribe PrEP and how frequently people need to be seen. But the most important thing is that PrEP providers feel a lot of joy with their PrEP experience, and they will give you some credit for giving them that joy.
So this can actually be a win-win in terms of joy and in terms of healthcare on both sides, both with consumers and providers.
That's exactly right, Damon.
Yeah. And how often in our lifetimes have we had an opportunity like this to curb a major disease through something that is joyful and healthy?
Well, there you go. I think that PrEP is our first opportunity to really prevent HIV transmission using something that is really powerfully supportive of people's sexual and social goals.
Yeah.
So people can have fun and stay free of HIV.
I love that. So much hope, so much joy in this room. Thank you, Dr. Grant. You're amazing. Thank you so much. So cool.